I think we've actually experienced a significant, though small, uptick in numbers. I think about the last time we spoke, we were maybe 4 or 5 patients in the hospital, maybe up to 6 or 7. We're now frequently in the double digits. This morning, we start the day at 11 inpatient COVID patients. And that kind of reflects what's going on in the state and in the capital region. We had a state nadir of COVID patients, the lowest in early September. We've now more than doubled those numbers around the state. And in the capital region, we've seen significant upticks, even more so than what we've seen at Ellis in Albany and Columbia counties, suggesting we've really got to be careful going forward to this upcoming holiday season. The basic principles of preventing the transmission of COVID have remained the same. Masking in public places, social distancing in public places, hand hygiene whenever possible. And very important as we head into the holiday season, avoiding the temptation to congregate in large groups, especially indoors. This is very, very important. And I think experts and myself would recommend small holiday gatherings, not large ones. Come up with some creative ways of having the extended family get together, but keep the gatherings small. I think it's a cause for, I would call it alarm, but I think it's a cause for caution and a cause for us to think about redoubling or maintaining the efforts that have got us to the point where our rates have been quite low in New York State. So again, those basic principles to be applied. I think it is a cause for all of us to be prepared. In the healthcare system, we have to think about our supplies. We have to think about our bed capacity, our ventilator capacity. But a lot of what we anticipate might happening could be mitigated by a community response to masking, social distancing, and avoiding indoor gatherings. Well, first of all, I do want to say this is very good news. A 90% effectiveness of vaccine, which was announced today with the Pfizer product, is really good news. However, as has been cautioned to all of us, the general availability of vaccine for the population as a whole, I think, is uncertain and certainly would stretch into next year and is not going to help us in the early part of this or late part of this year and the early part of next year in all likelihood. We've got to stick with the basic principles. We know that flu shots can prevent flu, though not always as effective from year to year. We also know that flu shots can decrease the severity and complications related to flu when we do require it. The diagnosis of folks with flu can be very much confused with COVID, but more importantly, the resource that we need, hospital staff, ventilators, drugs that we need for COVID, can be consumed by a flu epidemic. So by getting our flu shot, we better prepare for what's probably going to be an increased rate of COVID cases over the next couple of months.